Hello, my name is David James, and I serve as co-chair for UAB's Safe Mobility Oversight Team. And today I'd like to share some tips and best practices for safe mobility. Specifically today, I'd like to talk about purposeful rounding, pausing for safety, tips for our gait belts, other equipment you might see, and then scripting for success. So one of the most important tools we have for safe mobility is purposeful hourly rounding. And I want to stress purposeful. As we're rounding on our patients, it's important we address those 4Ps: pain, potty, possession, and positions. By systematically addressing the 4Ps, we can reduce falls. And we can also prevent ourselves from being a human ping pong ball. So always make sure that you take that moment to pause and address these 4Ps when you're working with your patients. Another thing we need to do for safe mobility is to pause for safety. So why is it important? So it's easy to get caught up in the moment and miss potential safety issues, such as tethers or improper footwear. So by explicitly pausing to check for potential safety issues, you're communicating to the patient and role modeling to your peers that safe mobility is the primary goal. So how do we do this pause for safety? Well, it's simply just explicitly saying, we're going to take a moment and check for safety. So you might say something like, before we get up, let me do a quick safety check to make sure we're ready to move safely. As we do that quick safety check, in our mind, we're running through a checklist of various things. So we have a pre and post safe mobility checklist, kind of some things you want to make sure you're checking before you actually mobilize your patient, and then things to make sure you're doing after your mobilization intervention. So for example, before we get up and move, we want to make sure our wheels are locked, we have the proper footwear on, we've addressed any tethers that we may have. And before we leave the patient, after our mobility intervention, we want to make sure the patient wheels are locked on their chair or bed. We've addressed the 4Ps, that they have their call light within reach, and we've connected any tethers that we had disconnected before. Again, just making explicit the things we're doing when we're taking care of patients, providing safe mobility. The other best practice intervention we have are gait belts. So gait belts are tools to help us provide safe mobility to patients. So two big kind of takeaways for gait belts is the first is the gait belt is about you and not the patient. So the script I use with gait belts is, I'm going to use this gait belt. It gives me a safe place to hold on to. If you make it about you, the patients will be more receptive to allowing you to use the gait belt. Otherwise, they're liable to say, I don't need that, don't use that, whatever. The other big consideration is, remember, gait belts can go anywhere on the patient's torso, from waist up to under their arms. So if the patient's pregnant or has a surgical incision or a colostomy bag, you can always just go above those things to produce the gait belt. In addition to the gait belt, we also have safe patient handling equipment on the units. These are deployed based on patient population and needs. So we have the Steady. So these are great for patients who can pull themselves up, but they just might not have the strength to make those, to walk a great distance. So this is great for getting patients to the bathroom or helping patients get from one area of the unit to another. And then we have the Sarah 3000. This is a mechanical device to actually help lift patients to that standing position. And then, of course, we have our Hoyer lifts, which are great for helping patients who are unable to mobilize get off the floor or either get from the bed to the chair. We also have slide sheets to reduce friction when we're mobilizing patients in the bed. In addition to the tools, we also want to focus on scripting and how we frame safe mobility. So if you say, do you want to get out of bed? You're probably going to get a no, because nobody wants to get out of bed. So be mindful, if you ask a yes or no question, you might get a no. So for scripting, we really want to focus on connecting safe mobility to the patient's goals. And we can do that by focusing on why. Why is safe mobility important? And then connecting that to what matters to the patient, such as going home or avoiding complications. Always keep the focus on the goal. What is today's safe mobility goal? As a frame for this, we always want to feel empowered to stop. So we stop if it's not safe. So if you don't feel safe mobilizing the patient, if the patient doesn't feel safe, we simply stop. The goal is safe mobility, not mobility. And celebrating all wins. So maybe the patient's goal was to walk around the unit for a lap or two, but all they could do was simply get to the chair today. Well, that's fine. They're out of the bed, and that's a win. We want to celebrate any wins the patient has. So putting all these scripting things together, it may look something like this. So, hello, Mr. Smith. My name is Dave. I'm going to be your PCT today. I see one of your goals today is to get to the chair. I know how important it is to get out of bed. It will help you get home faster. So I'm here to help you get to the chair. We can do this now, or I can come back in 30 minutes, 45 minutes, and we can do it then. So once we get an agreement from the patient, so okay, great. Before we get up let me do a quick safety check to make sure we have everything we need. So I'm going to use this gait belt. It will give me a safe place to hold on to when we get up. So it's once we get to the chair, it's great to see you in the chair. Let me do a quick safety check. And again, here I make sure the tethers and all that stuff. Make sure you have everything you need. If there's anything else I can do for you, and thank you for your time and thank you for working with me this morning. So again, scripting for success, hitting in on those safety and best practices we talked about. So some resources to help you with safe mobility. We do have a safe mobility brochure for patient and family education. If you find that patients don't quite understand why we're focused on safe mobility, or you think this can help them better engage with the process, just please reach out to your unit manager. We'll be happy to help provide those. And remember, acute therapy, both physical therapy and occupational therapy, are coaches and resources for you, as well as myself and my team on the Safe Mobility Oversight team. We're always glad to provide assistance or resources that can help you. So with that, I'm going to thank you for your time. If you have any questions, just please reach out.